Marsh Professional Simulators can bring your training to life with detail and real emotion to improve the skill level of your professionals. Marsh Professional Simulators originated at the University of Pittsburgh School of Medicine, where experiential learning was proven to be beneficial. As an innovative program in the 1980s, our actors, or simulated patients, were used in training up-and-coming doctors to prepare them for real-life experience. Marsh Professional Simulators has grown to assist premier hospital residency programs, medical conferences, and pilots for national medical communication seminars. Other work includes executive skill assessment, restaurant staff training, customer satisfaction training, and career placement training. Our business clients have included a wide range of companies, from Development Dimensions Incorporated to the Steamfitters Local 449 and Indiana Train, a division of Ingersoll Rand. Here are two very brief segments of simulations, one for medical education and one for customer satisfaction training, to provide a quick glimpse of what we can do for you.
Dr. Winters, Sam Brown, right?
Yes.
Sam, what brought you in today?
I have headaches and my wife is concerned.
What kind of headaches?
I don't know.
Do you have one now?
Yeah.
Where is it?
It's right here.
So on a scale of 1 to 10, if 10 is really bad and 0 is no pain, what would you call it?
Well, when I came in, it wasn't that bad. But now I would put it about a 5, and it's getting worse.
Have you figured out what kind of things make it better or make it worse, and what have you taken for them? Time out. I had a feeling I was losing you.
When you walked in and introduced yourself and asked me why I was there, I was ready to open up and tell you what was going on. And you continued with questions and grilling me with question after question, and I started to become annoyed, like I was being quizzed. It made me feel stupid.
Oh. Can I go back in and try it again?
Sure.
Hey, Dr. Winters, Sam Brown, right?
Yes.
Sam, what brought you in today?
I have headaches and my wife's concerned.
Can you tell me about the headaches?
Sure, it used to only last about 2 hours, but now it's lasting progressively longer. And it starts in the back of my head and moves over into my temples. And it is getting somewhat worse. It's actually keeping me up at night.
Time out. Better?
Better. You actually gave me time to think and speak, and I can answer your questions.
Oh, great, great. Sam Brown?
Yes.
Hi, I'm Dr. Winters.
Hi.
Is it okay if I sit down and we talk about what's bringing you in today?
Sure, please.
Great, great. How do you like to be addressed?
Sam's fine.
Okay, great. So, Sam, can you tell me what brought you in today?
Sure, I have headaches, and my wife's very concerned.
Can you tell me about the headaches?
Sure, I'm sure it's nothing. That's what I keep telling my wife. But they've started about a month ago, and started lasting about 2 hours, but they've been lasting progressively longer and getting worse. They start in the back, like lower back of my head, near my neck. Then they move around to the sides, and it's been so bad that it's been keeping me up at night.
Oh, sounds like it's been really difficult for you.
Now we're dealing with it, but my wife's really worried.
What do you think your wife is worried about?
My father died just about a year ago of a brain tumor. And she's really fixated on that, and I keep telling her that's not it.
Oh, sounds like you guys have really been dealing with a lot. I'm glad that you came in and we can start trying to get to the bottom of what these headaches are about.
Thank you.
Can you tell me a little bit more about the headaches?
Sure. Again, they started about a month ago, just lasting about 2 hours during the early afternoon. And now it starts in the early afternoon, and
I was wondering if I was a bit off track in asking about your wife's concern before I asked more about the headaches. Did that throw you?
no, not at all. In fact, when you asked me about my wife's concerns, I knew that you were not only caring for me, but you were caring for my wife too, which made me feel very well taken care of. I also knew that we would come back to talking about the headaches later, which we did. And then when you addressed the fact that we were going through a lot, or you must be going through a lot, I knew I was in the right place and being very well taken care of.
Great, great.
Marsh Professional Simulators prepare, learning the case, goals, and skill set. Marsh Professional Simulators act, bringing your training to life with details, emotion, and prompts. Marsh Professional Simulators react, rewarding skilled behavior with more information and emotional let-up, and sending error messages for unskillful behavior. Less information, more obvious emotion, and attachment.
Hey lady, I'm from ABC Mechanical. What's up?
What's up? I'll tell you what's up. My shop is 85 degrees. I have women leaving in droves so they can't stand to be in the place. And I'm losing money like mad. That's what's up. Look, I called ABC yesterday morning. You show up now, it's 5 o'clock.
Hey lady, don't yell at me. It's not my fault. You want to complain, call my boss. Now, do you want me to fix the air conditioning or not?
Yes, go. And I will call your boss. And I'm never calling ABC again.
It wasn't my fault we came late. It seemed like you were blaming me.
Well, I appreciated that you showed up. Your demeanor and appearance, and when you said it wasn't your fault, it made me frustrated and made me think that both you and ABC were unprofessional and irresponsible. And then I'd probably regret calling ABC.
So could we try it again just right after where you yelled at me?
Sure. I called ABC yesterday morning. It's 5 o'clock. You just show up?
I'm sorry I didn't get here till now. Let me go see if I can get the air conditioning working for you.
Thanks.
Seem better?
Yes. When you apologized, it made me feel appreciated, and you were working towards a solution. So thanks.
Thank you. Hi, are you Jane Carlson?
Yes,
Hi, I'm Joe Smith from ABC Mechanical. How are you?
I called you yesterday. My shop is 85 degrees. I have women leaving in droves because they can't stand to be in here very long, and I'm losing money like mad. That's how I am. Look, I called ABC yesterday morning. It's 5 o'clock. You just show up today?
I understand how you feel. I'd be frustrated and angry if I were you also. Listen, I take full responsibility for this. I apologize for the situation, and I'm going to resolve this as quickly as I possibly can. And as soon as I'm done, I'll call my boss and see if there's somehow we can make this up to you.
Well, I appreciate that. And yes, if you can get it running, that would be great. And I do apologize. It's just, I've had a rough couple of days, a lot of pressure, so thanks.
Absolutely. Can you show me where the equipment is?
Yeah, it's just right off this way.
Okay. I wasn't sure if saying I'd be angry too was the smartest thing to say. Was it?
Well, when you said if you were in my place, you'd be angry too, it made me feel respected and understood, and I started to calm down a little bit.
And when you said that you'd try what you could to fix my AC and then get in touch with your boss and see what else you could do, that made me feel like a valued customer and that I could trust you and ABC. So thanks.
Thank you. Okay, thanks.
Let Marsh Professional Simulators bring your training to life, using the primary teaching method or your own training techniques. Our cases or your own. We can customize our role plays to meet your unique training needs for medical education, management assessment, customer satisfaction, waitstaff training, career placement, and legal performance. To become confident using any new skill, you have to practice. Our clients agree. Using Marsh Professional Simulators improves training and results. To explore how we can help solve your training challenges, contact us at 412-848-4349 or marshsimulators.com.